Hey, Alpha Nurses, I'm Licensure from alphanursguy.com. This is 5 NCLEX questions. Without delay, let's get started.
A prima gravida client admitted to the labor area in early labor tells a nurse that her brother was born with cystic fibrosis, and she wonders if her baby will also have the disease. The nurse can tell the client that cystic fibrosis is 1. X-linked recessive, and the disease will only occur if the baby is a boy. 2. X-linked dominant, and there is no likelihood of the baby having cystic fibrosis. 3. Autosomal recessive, and that unless the baby's father has the gene, the baby will not have the disease. 4. Autosomal dominant, and there is a 50% chance of the baby having the disease. The correct answer is 3. Cystic fibrosis and other inborn errors of metabolism are inherited as autosomal recessive traits. Such diseases do not occur unless there are 2 genes for the disease present. If one of the parents does not have the gene, the child will not have the disease. X-linked recessive genes can result in hemophilia A or color blindness. X-linked recessive genes are present only on the X chromosome and are typically manifested in the male child. X-linked dominant genes, which are located on and transmitted only by the female sex chromosome, can result in hypophosphatemia, an inborn error of metabolism marked by abnormally low serum alkaline phosphatase activity and excretion of phosphoretinolamine in the urine. This disorder is manifested as rickets in infants and children. Autosomal dominant gene disorders can result in muscular dystrophy, Marfan syndrome, and osteogenesis imperfecta. Typically, a dominant gene for the disease trait is present along with a corresponding healthy recessive gene. A 24-year-old prima gravida client who gives birth to a viable term neonate is prescribed to receive oxytocin intravenously after delivery of the placenta. Which of the following signs would indicate to the nurse that the placenta is about to be delivered? 1. The cord lengthens outside the vagina. 2. There is decreased vaginal bleeding. 3. The uterus cannot be palpated. 4. Uterus changes to discoid shape. The correct answer is 1. The most reliable sign that the placenta has detached from the uterine wall is lengthening of the cord outside the vagina. Other signs include a sudden gush of vaginal blood. Usually, when placenta detachment occurs, the uterus becomes more firm and changes in shape from discoid to globular. This process takes about 5 minutes. If the placenta does not separate, manual removal may be necessary to prevent postpartum hemorrhage. The cervix of a prima gravida client in active labor who received epidural anesthesia 4 hours ago is now completely dilated, and the client is ready to begin pushing. Before the client begins to push, the nurse should assess 1. Fetal heart rate variability. 2. Cervical dilation again. 3. Status of membranes. 4. Bladder status. The correct answer is 4. The bladder status should be monitored throughout the labor process, but especially before the client begins pushing. A full bladder can impede the progress of labor and slow fetal descent. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanursguy.com. Back to the questions. Which of the following would be the priority when caring for a prima gravida client whose cervix is dilated at 8 centimeters when the fetus is at 1+ station and the client has had no analgesia or anesthesia? 1. Giving frequent sips of water. 2. Applying extra blankets for warmth. 3. Providing frequent perineal cleansing. 4. Offering encouragement and support. The correct answer is 4. The client is in the transition phase of the first stage of labor. During this phase, the client needs encouragement and support because this is a difficult and painful time. A prima gravida client whose cervix is 7 centimeters dilated with a fetus at 0 station and in a left occipital-posterior position requests pain relief for severe back pain. The nurse should 1. Provide firm pressure to the client's sacral area. 2. Prepare the client for a cesarean birth. 3. Prepare the client for a precipitate birth. 4. Maintain the client in a left sideline position. The correct answer is 1. The client who has back pain during labor experiences marked discomfort because the fetus is in an LOP position. This pain is much greater than when the fetus is in the anterior position because the fetal head impinges on the sacrum in the course of rotating to the anterior position. Application of firm pressure to the sacral area can help alleviate the pain. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.